Let's turn now to the latest on the COVID pandemic as the number of cases continues to rise across the country. Nearly every state is seeing an increase, up more than 46% from 2 weeks ago. The U.S. is now averaging more than 73,000 cases a day, but tracking the pandemic has gotten more difficult as COVID testing has gone down and a lot of it's happening at home. Joining us now is NBC News medical contributor Dr. Kavita Patel, of course, our friend. Dr. Patel, always great to have you with us. So a COVID modeling group from the University of Washington actually estimates that only 13% of cases are being reported, which would mean that more than 500,000 new cases are actually happening each day. But walk us through this. I mean, it's probably because a lot of these tests are happening at home. There's nowhere to report that. We want people testing and then staying home. So how do you weigh that out with people instead going out to get a PCR test or something like that?
Yeah, I think that you're right, Savannah. A majority of people now, because of widespread availability of home-based testing, have been doing home-based tests. But keep in mind that this is also missing, like you mentioned, kind of non-PCR tests. We still have a good handle on PCR testing, but fewer and fewer Americans are getting that because many people are coming into my office and they're going into urgent care clinics and also getting rapid tests. Those rapid tests, when they're positive, depending on where you are, city, state, and county, do sometimes get reported, but not consistently. And even more troubling is that some places like DC and other cities, have really shifted to only reporting every week or so. And that means that when we see these test numbers, we used to get them daily. Now we're not getting them until they're batched, maybe after weeks.
And Dr. Patel, as cases keep rising, here's something. The vaccination rate in the U.S. has remained relatively flat. Just more than 65% of Americans have been fully vaccinated. That number really hasn't changed in a while. What do you think is factoring into this continued vaccine hesitancy from millions of people? And that 35%, is there anything that we can do to convince them?
Yeah, listen, this is kind of my daily job. I keep trying to nudge the 35% just day by day. But I think the biggest factor, honestly, is a little bit of vaccine skepticism. We used to call it hesitancy or skepticism. I think there are a lot of people that said, look, I know X, Y, and Z who got vaccinated and also got infected, and they're getting the same type of infection. And I also know A, B, and C who are not vaccinated and they got infected.
Right.
So I think we need to do a better job explaining what vaccines protect against. But I think Omicron changed the game. We need to explain how these variants are now making it even more important to stay up to date, which includes boosters as well.
Such a great point, Dr. Patel. That's something that I've heard from people that I know in my life. It's like, if you're still going to get sick, what does that mean? It's so important. You're right. I also want to ask you about the COVID antiviral drug. I feel like we haven't talked about this that much. Paxil. That's what Vice President Harris took a few weeks ago after she tested positive for the virus. There have been some reports of some patients relapsing after taking the drug. Then there was some back and forth from the FDA and the CEO about if that means you should just take more. But what should we know about the potential effects of Paxil? Should we be worried about this at all? And can it really help?
Right. So bottom line, yes, it can really help. I've had a lot of experience prescribing this because I do believe in the study that supported the treatment where in unvaccinated people, especially, Savannah, you see an 89% reduction in hospitalization and death. It's dramatic. And then we also know it has benefits, again, in hospitalization and death for vaccinated high-risk individuals. 5-day course, twice a day. The most common effect is during the course, a metallic taste. I have patients who tell me it feels like I'm sucking on pennies. The other thing that you're describing is this relapse. There's a lot more reports of it in social media, but we still think that the percentage is probably somewhere around 5 to 10% of people are getting improvement of symptoms. And then when they stop the course of drugs, several days later, they're getting the recurrence of those symptoms that started their diagnosis of COVID to begin with. And when they take a rapid test may have been negative 2 days earlier, and it'll be wildly positive. So here's the bottom line. If you take Paxil, we still recommend it, still a good drug. We are looking into whether or not we need to extend the course from 5 days to 7 to 10. They're studying that right now. Don't do that on your own. Talk to your doctor. And if you see this relapse, it's a good idea to kind of stay away. You kind of think of yourself as having to re-isolate, but discuss that with your doctor so you can know how to take precautions to keep yourself and your family safe. But here's the really good news. So far, we're not seeing hospitalizations in these relapses. That's what we're watching for. Doesn't feel good to get those relapses, but it would be really devastating if we saw people going into the hospital with those relapses. Crossing our fingers, not yet. But it just shows you, Savannah, how much we don't know sometimes about this virus and about the drugs that are effective and safe, but still learning about a new virus.
Yeah, absolutely. A lot to learn there because I think people would be confused. Why am I re-isolating if I was on my way out, if I wouldn't have taken this medicine? But you're right, in terms of the hospitalization factor is so important. Dr. Patel, love to have you with us. Thank you so much.
Thank you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.